See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hey, See You Now listeners, it's Shauna Butler. Welcome to August and to Civic Health Month. With democracy, voting, and health policy playing prominently in local and national headlines and ballot boxes around the country, we're returning for another listen to our episode, Ready to Vote? And the vital role healthcare places and professionals play in the political determinants of health. Since we originally produced this episode, our guest, Dr. Alister Martin, was selected as a White House Fellow and is currently serving in the Office of the Vice President and the White House Office of Public Engagement. Congrats to him, and we're all a bit healthier for his service.
Every year, there are innumerable elections around the country, and those are the elections impacting things like, do I have groceries in my neighborhood? Are the parks where I live safe? Can I get access to good jobs?
There's almost 800,000 people on GoFundMe trying to buy insulin, medical care.
We can't even begin to talk about some of the downstream ways of engaging civically when we have nearly 1/3 of our voting age eligible patients who are not registered to vote.
Many people had never been asked or even had some myths about when you would or would not be eligible.
The first step is to help patients vote and have a seat at the table.
When we think about who are the types of novel messengers we need to talk with us about democracy and our vote, we need people who we actually believe in and view as people who are trusted messengers. Our healthcare spaces are a really innovative place to ask people about voter registration.
Welcome to See You Now. I'm Shauna Butler. Voting and health. It's not been a pairing that immediately springs to mind. But the pandemic, for many reasons, put a spotlight on this dynamic duo and how they impact and amplify one another. In addition to highlighting a broad range of health inequities and forcing every facet of healthcare to rethink how it's delivered, the pandemic had us also scrutinizing the details, the dependencies, and complexities involved in our voting and voter registration processes. Indeed, with shelter-in-place orders, many businesses, government agencies, and schools closed, and most of us working from home, voter registrations across the country, unsurprisingly, saw a sharp decline as many of the traditional community touchpoints for voter registration weren't available or had been disrupted, canceled, or significantly curtailed. And while the COVID pandemic sharpened our attention on the health and safety details of the registration and voting process, it also intensified our awareness of how voting and ballot measures dramatically impact the policies that shape individual, environmental, and community health. It heightened our awareness of not only the social drivers of health, but increasingly the political determinants of health and who is not part of the electoral process. We're airing this episode in August, a month well known for long hot days, outdoor sports, vacations, and as of 2020, civic health that includes a nationwide effort to magnify the role of healthcare in civic engagement, healthy communities, and voter access. Recognizing the crucial importance of upcoming elections, we encourage you to check out Vot-ER's virtual Civic Health Conference on August 12th and 13th, featuring conversations on the critical role health professionals can and do play in expanding civic access for our communities, and prepare you with the data, know-how, and enthusiasm to increase the civic participation of the people and communities you care for and about. Learn more and register to attend at the Vot-ER website. That's vot-er.org/conference. In this episode, We're taking a closer look at civic health by inviting 3 civic health innovators to share the wide array of your daily health experiences that show up on a ballot, why healthcare settings and healthcare professionals are particularly effective messengers and catalysts for voter engagement, and discover innovative tools available to improve the health of patients, colleagues, communities, and democracy itself.
I'm Elizabeth Cohn, and I'm the Associate Provost for Research at Hunter College in the City University of New York. And I'm the founder and director of Nurses Who Vote at NursesWhoVote.org. And we are providing voting education and voting materials specifically geared to nurses. And I was a volunteer vaccinator during COVID and very, very proud of the work that I do with Vot-ER and our mission to really preserve and save our democracy.
So I'm Alister Martin. I'm an ER physician and an assistant professor at Harvard Medical School and the founder of Vot-ER. And what we do at Vot-ER is we sit at the intersection between health and civic engagement in a way that empowers both patients and providers to vote like their health depends on it.
My name is Aliya Bhatia. I'm the Chief Operating Officer at Vot-ER, and in that work, I get to work with a range of nurses, physicians, social workers, designers, data extraordinaires, and more, all in service of building a healthier and more inclusive democracy.
What was your very first experience of when you got to vote? Do you remember when you registered and when you came of age? And what your very first voting experience was like?
Shauna, I do remember the first time I was asked to register to vote. The first time that I was explicitly asked about voter registration was renewing my driver's license at a DMV. And it turns out that that is one of the few places where we have institutionalized this idea of asking people about voter registration. And when you look at who is registered to vote, 45% of registered voters registered to vote at their Department of Motor Vehicles while doing something related to a driver's license. And on the one hand, we should celebrate that embedding voting in our normal processes is something that we can do. But we should also be really nervous about the one place that we've made that completely normal. Who goes to their Department of Motor Vehicles? People who are
how often?
And how often? Exactly. Yeah. I can't remember when that was, but I do remember being asked. You know, when we think about that, it's going to be people who are generally wealthier, more educated, older, and that's exactly what we see in our voting population. And everyone should be concerned about that. The people who should be most concerned about it, Shauna, are those who are working in our health space, who are seeing those most hurt by the health system, because those folks are not in the same proportion participating in our process, and their voice is not being heard when it comes to health equity policies in the same way as somebody who might be able to every 5 years show up at their DMV and get asked about whether they need to update their voter registration. So it really ties in how important it is that we normalize it in more spaces, because otherwise the folks who are calling as constituents to their congressperson's office or who are casting their vote and seen as regular voters is not necessarily the group of people who most need our health systems to perform for them.
You raise a really important point as far as who shows up at DMVs. There is a whole category of folks that will probably not show up with DMVs. And you think about those with cognitive or physical differences that driving just isn't a possibility. So if that's the place where you're going to get introduced to voting and registering and you never walk through those doors, there's just a whole group of folks that we haven't set up an institutional, traditional way to even introduce them. When is it that most people hear about voting? How do they hear about voting? Who do they hear it from?
In this country, we have over 50 million people who are not registered to vote. And when you look at the demographics of who is not registered in this country, that's the folks who are most vulnerable. tend to be younger, tend to be lower income, are more often likely to be people of color. And what we find is many of these folks don't have the easiest time navigating the system. There are so many hoops to jump through. This ID you need, this time you can register to vote online, but maybe not that time. It is a little bit like running an obstacle course for many patients when it comes to thinking about how they interact with our democracy and how they can do the simple act of voting. And when you ask those folks who are not registered to vote, why haven't you registered? The majority simply say, no one has ever asked me. And so we are offering in our healthcare settings and sites and hospitals, of course, in a non-urgent way for patients who don't have any acute complaints. What these healthcare providers are doing across the country is inviting them. Many of them have not had the invitation to register to vote, to sit at the table of our democracy. And we're finding that it's been very, very successful throughout the country.
When you bring that up, that so many people have never been asked to vote, I clearly live in a bubble. I do remember my very first time registering to vote, registering as well as voting. It was a huge rite of passage. And I remember learning about and participating, and it never occurred to me that it wasn't something that was possible. When we are talking with healthcare professionals, clearly this is a very educated group. So I think that that's such an important point to hone in on, is how many people have never been asked and didn't realize that they were eligible to vote. It really blew the blinders off of me to understand so many people have no idea and have never been invited. And so what a great opportunity that we have to introduce people to this beautiful participation in a democracy, in a collective way of decision making.
I think a couple of things may be happening at the same time. One of them is that there's a little bit of a generational thing. If you saw some of the struggles around voting in the 60s, as I did, and as my parents' generation did, you really understand how hard we fought for that. And at the same time, some people see voting as something that everybody always had and everybody always will have. And we're seeing an increase in engagement of younger people who may not have realized what the struggles around voting were. I do actually remember I registered and voted early. My parents were very committed to civil and social justice issues. I lived in a very, very small town in upstate New York called Hoosick Falls. And we were introduced to voting there through our water tower. When you voted for local candidates, you flushed the toilet when your candidate's name was announced on the radio. And so the toilet flushed and they measured the water tower, and then the toilets flushed again and they measured the water tower again, and people could win by a number of flushes. So there was a lot of local campaigning because the voting was really based on you being home and ready to flush when your candidate was selected. So I think for me, it drew a real connection between what I was doing and how things were going to be run.
Really? That is a voting mechanism?
I don't know if they still do it, but when we were there, that is how we voted.
By toilet flushes?
By water tower level.
Oh my goodness. Until you go back behind the curtains, figuratively and literally, there isn't a deep awareness of how much is involved in the preparation, the logistics, the operations of making voting available and making it safe and making it secure and accessible. There are just so many different dimensions.
In the midst of a pandemic and myself completely unvaccinated, I actually stood up a polling place in a Boys and Girls Club in the city of Glen Cove so that people in housing projects could exercise their right to vote. I was supervising the polling site. On my birthday, I have to tell you, November 3rd, 5 a.m. to 11 p.m., having people lean over me to sign the pads because I just felt like in this time, even unvaccinated, it was worth it at that time for people to be able to exercise their right to their voice.
So I want to go to this question of voting and health. We don't necessarily put those two things together, but there's a very clear relationship. Liz, I was wondering if you could dive into that and help us understand what is the relationship between voting and health in all realms.
We really see a connection between voting and health. There was a recent public health review article about everything that's been published in public and health recently by an investigator named Brown. And I think they put it really well when they said voting affects health as it shapes who is in power and the policy that's made, and individual health can affect voting. And what they showed with this review was that not only does obviously voting dictate who's in power, and who's in power dictate our policies and our approaches and some of the levers of the health of the nation, like reimbursement and how health and insurance coverage is distributed, but they actually were able to draw a connection in this review between the agency of individuals in voting and their own agency in improving their own health. And obviously there's a lot more to it of the socioeconomic drivers behind it, but they were able to really show that it's really reciprocal, that voting affects the health of people and that the health of people is actually improved by voting. And a lot of that is driven by the policies and who's in power. So it's really a larger societal issue, thinking about what we need as a society to be healthy as individuals, as communities, and in the policy realm. But I think that we're starting to see now practically and also in the academic literature that relationship be more defined.
Alister, you're in this every single day. Can you share from the standpoint of what you see the relationship between voting and health at the personal and the community level?
For the healthcare providers that are listening to this, I'm speaking to you directly on this. You see the faces of failed health policy every single shift that you work, and those faces are not smiling, right? I just worked a shift last night in the ED here, and I would say, Shauna, that probably 50% of the patients that I took care of last night in our emergency department had no acute medical need. They were there because of some health-related social need. They were there because they needed a prescription written, or they were there because they did not have a place to sleep, or they were there because they were looking for how to get into detox for drug or alcohol issues. And so we see on a nightly basis really how broken our healthcare system is. At the end of the day, we as healthcare providers have to, we're fixers.
Yeah.
Right?
Yeah.
We're fixers.
Yeah. We want to make things better. We want to help people. Yeah.
Listen, we don't like to be complainers. We want to get involved and be part of the solution. And truly, if you want to be part of the solution, you have to go upstream and you have to figure out how to empower your patient. I'll tell you a story. So I had a patient who I took care of in our emergency department, young woman, in her early 20s, diabetic. And, she came to our emergency department because of nausea and vomiting, fatigue, and turns out that she had diabetic ketoacidosis. And it's an incredibly rare complication of diabetes. And it typically happens when you're not taking your insulin. And so I was at sign out, and, we have the attending physicians and the residents and the nurses all gathered around the station, and we're hearing the sign out from the previous team, and they're telling me this is her second time this week having DKA. And, the sign out was, and we're just gonna have to do some diabetes teaching, make sure she knows how to take her insulin. So I said, okay, I got that. But let me go listen to her story, because this doesn't make any sense. How does a 20-something-year-old get DKA twice in 1 week? And so I go talk to her, and she says to me, Doc, look, it's not that I don't want to take my insulin. It's that I don't have any. She recently got a promotion at her job, which increased her salary just over the limit for her to qualify for Medicaid in our state, meaning she lost her health insurance and she was rationing her insulin. And I remember thinking to myself, man, we got this one wrong. We pinned the blame on her non-compliance and her not wanting to be involved. In reality, the problem was an upstream policy decision that was made that at X dollars and Y cents, you no longer qualify for insurance. And she had to deal with the consequences of that. And guess what? We all, as nurses, as physicians, as social workers, we have to deal with the consequences of what those decisions at a higher level are. And we ought to be at the table helping to make some of those decisions. And the easiest way to do that is by empowering our patients, empowering ourselves to vote.
Yeah, I have to build on that for a second. I was contacted by a student of mine from about 10 years ago who said the most important thing that I had ever taught them was that non-compliance is on us, because we either haven't made it available, haven't made it easy, haven't adjusted for lifestyle. And so we need to really take a much, much deeper dive. There's almost 800,000 people on GoFundMe trying to buy insulin, medical care. What is that? Where did that come from? And how did we allow that to happen? These are people who are like, please help me with my hospital bills, with my everyday drugs that I need. That's where we are now because of some of the policies that we have. And Alister, to your point, what an impossible choice. Accept the promotion and lose your health benefits, or don't accept the promotion. We've set people up with these absolutely impossible choices. And that's not the only one. There's ones that have to do with keeping families together and where they can live, like Section 8 housing. There's a lot that goes into those that breaks people apart instead of building them up.
The relationship between voting and health. These are some great ones as far as diabetes and housing. What are some other ones that maybe just never occurred to anybody that you'd only know because you'd experienced how that policy unfolded in a real life set of circumstances?
The reality is that when we think about what constitutes good health in this country, 80% of the factors that contribute to someone actually being physically healthy in this country have nothing to do with what happens for that patient in the hospital or in the clinic or in the community health center. And it has everything to do with where that person lives, the kind of education they have access to, the kind of food and diet they have access to. And we collectively refer to this 80%, right, as the social determinants of health. And we are trying so hard with this very small piece of the pie, this 20%, which is clinical medicine, to make people healthy. And the bottom line is it's not really possible. We are a repair shop. As nurses and as physicians, patients come to us with ailments and we try and patch up the issue. We try to repair the thing that's broken and we send them back on their way, back to a broken system, back to a broken home, back to a food desert. And so we can't begin to contend with the true health of our patients unless we begin to contend with these social terms of health. And my argument, and the growing civic health movement makes, is that you can't address the social determinants of health without going upstream and grappling with the political determinants of health, the structural elements, the policy, the socio-political context, the economic situation that patients live in. And the only way to affect that, the first step, is to help patients vote and have a seat at the table in terms of helping to shape some of those policies.
We talk about access to care. We know it's a problem, and there are many, many, many dimensions. It seems like there's an awful lot of similarities between access to care and access to voting and how that's actually impacting our health and our well-being. How would you describe, or how would you compare access to care and access to voter registration and voting?
I'm looking at this as a patient. I'm not a healthcare provider. So that's the perspective that I might bring on the access to care piece. There's several barriers. There's a few that at Nurses Who Vote and Vot-ER that we particularly address. To give a sense of some of those barriers, I want to tell a quick story about the last election cycle. Had the chance to drive a handful of voters to the polls, one by one, wearing masks, roll your windows down, essentially a COVID-adjusted drive a voter to the poll type of program. And in my conversations, I would, ask, why are you voting today? All three of the people who I had a chance to take to the polls said they tried to vote early in some form or fashion. And the thing that got in the way is completely arbitrary for all of them. For one of them, it was the absentee ballot did not show up at their home in time, and then their car broke down. For another one, visually impaired, so needed someone to take her to the polls, plans with her friend to take her to the polls, shows up and they're like, oh, the polling location isn't here anymore. Third one works crazy shifts. Ultimately, the way that she got to the polls was taking her lunch hour And I drove her during her lunch hour because she was committed to making sure that she could vote. And the parallel that I see and experience more from a patient perspective and not as a healthcare provider is just the level of arbitrariness around that. And there's ways in which the system that we have ideally could change, get more comprehensive, predictable, direct. But there's also ways in which people like healthcare providers in particular can address some of those things. And the two that I want to lift up, one we've already talked about, which is there is a huge gravity of omission right now in how we do voting. We don't have people asking people about registering to vote per that 62% who say that they have never been asked about the question. And our healthcare spaces are a really innovative place to make sure that at the same time that you're asked, do you smoke? Do you drink? Are you registered to vote? We already asked these hard questions. I take it seriously when my healthcare provider asks me those questions and I have to pick between some sliding scale of how I'm doing on that metric. The second innovative way that we can help address that arbitrariness is ultimately that arbitrariness wears away at our trust in the system. And when we think about who are the types of novel messengers we need to talk with us about democracy and our vote, we need people who we actually believe in and view as people who are trusted messengers. And nurses have been the most trusted profession in America for the last 19 years. Doctors and pharmacists had a significant boost in their trust over the last year. And those are the types of voices that we need to hear about questions about voting from. And if we're not hearing from voices who we trust is a really fascinating element of our democracy. In order for democracy to exist, we need to be able to pull out someone who isn't doing their work. We need to be able to have a healthy level of distrust in the people who are leading our institutions. But in order to have that distrust of the person, you have to have trust that the system can replace them. And that's where the trust is deeply frayed from the experiences of the three women who I described, who had such huge challenges just casting their vote and their ballot. So those are two areas: fixing the omission of not asking people enough, not reminding them that this is, an important thing, and then also tying that to the trust of the people who are asking them. Are those people trusted messengers who, when we hear from them, we know that they're in the interest of our health?
Liz, you have been thinking about this problem for a very long time. Nurses Who Vote. How did this come into being?
I've been a nurse for almost 40 years. My main career was in the ER. Now I teach health policy in a school of nursing in Hunter Bellevue School of Nursing, one of the oldest schools of nursing in the nation, at a minority serving institution, Hunter College, which is part of the City University of New York. We have a health policy class at every level, the baccalaureate level, the master's level, and the doctoral level. And I teach doctoral level health policy. And I started to teach the class a number of years ago. And I realized that the books that we were looking at were explaining a system that I was watching actually break down in front of my eyes, increasing numbers of people being placed in positions that they weren't really qualified for, including important positions in health departments and in the Department of Health and Human Services and Social Security and other safety net things. And I realized that the most important thing I could teach the students now is the history of voting, make sure that my students are registered to vote. And we launched a website, NursesWhoVote, and on it we put position papers of every current health policy decision that was being made. You could link to your state. You could link to your representatives. You could find out what current policies were up for voting in your state, and you could get information about that policy. And so the class flipped into this Nurses Who Vote event. We started going to nursing conferences to register people to vote. We had a table at the National Oncology Nurses Conference. And so we started visiting any nursing conference that was in New York and setting up a table to talk to nurses about the importance of voting and inviting nurses to register and please vote, finding the same thing that you found with patients, that many people had never been asked or even had some myths about when you would or would not be eligible, things about having moved, things about having had criminal records. There was a lot that came up. And we also experienced and overcame the awkwardness of asking somebody if they're registered to vote. Once we started, the students got more and more comfortable. I got more and more comfortable. I'm not sure why there was a stigma there to start with. And of course, we've overcome it now. And I've had 5 classes since then, and every one of them has carried this effort forward. And if you go on Nurses Who Vote, you can still find your town, your representative. You can put in your zip code. You can see who represents you across the government, local, national, and federal, and you can register to vote in your own state. But it did come from the place of realizing that until we review and remind and register people, we will not be able to have the democracy that we've taken for granted. And that was when we started Democracy at Discharge, which is just adding the question, are you registered to vote, or would you like voting information at the discharge process itself? Now going into 2022, we offer 2 other things: a voting registration kit that people who are teaching health policy can get, which includes posters, postcards, stickers that say, my voice will be heard in 2022, I'm registered to vote, and a number of other things that people can use: a poster for their classroom and a set of curriculum that they can use to talk about voting and the importance of nurses voting in their classes. So we sent out 700 kits since we started this effort. We were FedExing them across the country so that people could get a jump start. And I guess in a sense, if I'm being honest, get over immediately whatever there is around asking that question.
Well, one thing I want to pick up on is the insights that Liz made here, and in particular, her translation of the concept of the importance of voting to the concrete and practical application of this at the bedside. It's not just about the ideas. It's about how do you execute them and design them in a human-centered way, right? And you can't create a tool or an intervention that adds stress or frustration. So when we were thinking about how do we embed this into the workflow for physicians, for nurses, for social workers, it had to be easy, and it had to be simple, and it had to be sticky. So we created something called the Healthy Democracy Kit. So it has 2 things: lanyard that you wear. Then on the lanyard, it says in big, bold letters, question. And the question is, ready to vote? ? And you can see it from across the room. And it's meant to be visually triggering because once someone asks about that, the person uses the second part of the Healthy Democracy Kit, which is a badge backer that's attached to your badge. And on that badge, it has 2 things: a QR code and a text message code that patients can use to register to vote. It takes them less than 90 seconds. They can check their registration. They can get mail-in ballots. And the whole premise of this is that the patients do it themselves. They can choose to do it on their own phones, and it takes them, again, less than 90 seconds. And healthcare providers just triage to the website that we've built, where folks can hop on the phone with someone who's an expert 24/7 and talk about their voting questions. And so for all the nurses who are listening, we have a very easy way for you to get your own Healthy Democracy kits just in time for Civic Health Month in August, the national celebration of this intersection between civic engagement and healthcare. And all you have to do is text the words "Vote Nurses" to the number 34444. So 3 and then 4 4s. And there'll be 2 things on that text that'll come through. One is a link for you to get your own Healthy Democracy kit. It's free. Get it. It'll be there in a couple weeks. And number 2, a way for you to get your hospital, your clinic, your health center involved in Civic Health Month. And so we invite you to be part of this conversation. We can't do it without you. And, we'd love for you to be part of this work as we build this work out.
So Vot-ER, we've got a multidisciplinary team. We've got physicians, nurses, organizers, data scientists, lots and lots and lots of volunteers, and the concept of vote like our health depends on it. Can you share the story of how Vot-ER came into being and what you guys are on a mission to do? I have a feeling there was a moment, and it was probably a moment of frustration where you said, okay, got to do something about this problem.
Yeah, I was working overnight at a children's hospital here in Boston. And it's a Friday night, 2 a.m. And I had a young woman who came to me. She's probably in her mid to late 20s with 2 children. And she says to me, "Doc, look, I recently moved here from another state to escape an abusive situation that I had." She said, "Look, I moved in with an aunt here in Boston and things were going well. But over the course of the last 2 days, our relationship has sort of deteriorated. And she kicked me and the children out. And it's February and it's 2 degrees outside. And I slept outside with the kids in the van last night. And I knew tonight there was no way that we were going to do that again. So I came here because I didn't know where else to go. Can you help me?" And for the nurses that are listening to this and the other healthcare providers, you've been in this position where you're asked to try and solve a problem that's much bigger than clinical medicine. I said, "Of course, we're going to help you." Had no idea what I was going to do, how I was going to get housing for this young woman and her 2 children, younger than 3 years old. Call social work. I said to the social worker, "I need your help. We need to figure something out here." The social worker says, "Okay, good news is we can get her Massachusetts State transitional housing. I just need to have her produce some form of ID that proves that she's a Mass resident." So I go back, I say to the patient, "We can definitely help you. I just need to see something like a phone bill or utility bill or something that shows that you are a resident of the state." She says, "Doc, look, as I told you, I just moved here from another state. So unfortunately, I don't have anything." So I go back to the social worker. I said, "Help, SOS, she doesn't have anything. There's no other proof of residence. What can we do?" And he says, "There is one thing. We can register her to vote." And I said, "Come again?" And he said, "Yeah, her voter registration in the state of Massachusetts would count as proof of residence." And so a couple things happened to me at this time. The first was, wait, this is legal? Right? I had this sort of epiphany. And he said, "Yeah, of course it is. The National Voter Registration Act not only legalized, but encourages voter registration in hospitals." And then 2, when I actually went to talk to the patient, I said, "Look, we're definitely going to help you. I have one question for you though. Do you want to register to vote?" You know what her response to me was? "I didn't know I could. No one has ever asked me that before." And I started to think to myself, how many patients have I seen in my short career who are in the same exact boat? And so we've got to invite patients into the process so that they take a seat at the table and help us shape our democracy. And that's sort of the origin story where this work came from.
What were the next steps from the standpoint of setting this up?
So first of all, it was about 2 years of background work that needed to be done to sort of understand how we were going to make administrators comfortable with this new change, right? Because hospitals and clinics, they're a little bit like oil tankers, right? They move very slowly, and with great intentionality and with great focus, you can get that 1 or 2 degree difference, that turn, but it takes a long time to get people to feel comfortable with doing new and innovative things. And so, long story short, I did a lot of listening and tried to figure out what were the concerns that folks had. How could we address each of those concerns? And then how can we set the stage for creating an MVP, a minimally viable product? First sort of concrete form that this took was actually a kiosk where folks could register to vote in the waiting room. And we did that for a couple of months, and the roof didn't cave in. The sky didn't fall. And so we were able to sort of use that as, hey, look, not only are patients liking this, but the funding and the donations haven't dried up to the hospital. No one has complained about this. And in fact, this is something that we're getting news coverage for. And at the time that we're in now, where voting is such a contentious issue, we are on the right side of history here. And so we use that as sort of leverage to begin spreading this innovation. And we've been able to really diffuse this across the country to the point now where we have 700 clinical sites that use Vot-ER in some capacity. And we're not done yet. We're trying to get to the place in the future where any healthcare setting you walk into, you'll be asked about whether or not you want to register to vote or check your voter registration.
So, Aliya, on this mission to normalize healthcare settings as the community touch point for where we would think about civic engagement, and voter registration. Explain more about what Vot-ER is, what you guys are doing, and all of the different programs that you guys are running.
It's a really, really special place. It's a really special place. The part that Alister didn't mention when he talked about the Healthy Democracy Kit is there were kiosks and then there was the kit, but in the middle was March 2020, when you didn't want something that people could touch. You didn't want to transmit COVID, right?
Right. And we didn't have a lot of people going into waiting environments. We were asking people to do drive-throughs. So
everything changed. Everything changed. And the human-centered design feeling, I don't think we would have named it that way, but Alister was seeing in the ER every day how we could make this work better. And we were literally on a daily basis trying out new versions. That was also when we said to ourselves, this team has to be multidisciplinary. And we involved a brand manager from a major corporation. We got med students, social workers, nurses involved. We had health policy people involved on our team. And we just drastically shifted the way we thought about how we move forwards into a process. And so that process has taken us a few places, and it will continue to take us new places in the future. One of the places it's taken us is, how do we make sure there is a time every year where we celebrate this link between health and voting? And that's August, Civic Health Month. And it's a really wonderful time for organizations ranging from the American Nurses Association to the American Academy of Pediatrics to hundreds of hospitals to take at least one action where they're supporting staff, patients, to make sure that they're ready to vote and registered to vote. And the reason August is an annual event, and we often forget this, but every year there are innumerable elections around the country. And those are the elections impacting things like, do I have groceries in my neighborhood? Are the parks where I live safe? Can I get access to good jobs? Those local elections are dictating where a lot of those resources flow. And so the annual Civic Health Month is an important reminder of that to all of the different people who are within our ecosystem. Another important part of our work is the various tools. And Alister mentioned one of them, which is the Healthy Democracy Kit. We are continuously creating new versions and new types of this to fit in every different type of clinical care setting, and making sure that the tools work, whether you are a family practice doctor or you are an ER nurse or you are a social worker working closely with patients. We want it to work in every different type of clinical setting. And that is something that takes a lot of iteration and understanding. So that's a second big piece of the work. And then the third piece I want to kick back to Alister to discuss, which is, one of the interesting places where voter registration can become a normal thing is your annual flu shot. I'm thinking about how vaccination is something we go in, we're usually not in crisis, we're in preventative mode, our minds are already there.
Yep. So one of the things that we do at Vot-ER through a growing team of organizers and former campaign staff is we've actually developed a get out the vote strategy for how we actually bring vaccines into low-income communities and connect folks to the vaccine. And what we realized, we've vaccinated nearly 10,000 people across Boston and other parts of the state of Massachusetts, where 80% of those folks are people of color. What we realized was when we looked at the data, just over 50% of those who are eligible to vote from the folks who we vaccinated were not registered to vote. And so what we decided to do was figure out how could we create a way to merge vaccinations and voter registration. We created voter registration Band-Aids. These are Band-Aids that allow a patient to use the QR code right on the Band-Aid to register to vote. And it says right on it, ready to vote. So you can imagine folks leaving the vaccination setting with these voter registration Band-Aids. It's a big conversation starter. People scan the code and get registered to vote. And that's just one example, just like Aliya mentioned, of the way that we manifest this intersection between health and civic engagement.
Liz, maybe you wanted to chime in on that, some of the different ways that your organizations and your tools are combining forces.
In the recovery area of COVID vaccine clinics, I had stood up a nurse-centered COVID vaccine clinic in Hempstead, Newcastle in Long Island. We actually used some of these materials as people were in their 15-minute recovery period, which were absolutely fantastic. We have overlap both at the intersection of voting and patient care, but also at the intersection of health professionals and voting. There's over 4.2 million nurses in the profession. And if we used health as a lens to vote and encouraged our patients to do the same, nonpartisan, of course, but just keeping things that are generally linked to health, environment, schools, those types of things, if those are the lens through which we vote, all of the 4.2 million nurses, we could move health policy. Not all nurses would vote the same, but if we ever did, it would be a huge voting block for this country. So using lenses that health for both for our profession and then also for our patients at the point of care, we can really, really move the needle on all kinds of important aspects.
So Civic Health Month, I love this. Better health begins when every citizen has a voice in the policy decisions that affect their well-being. So it's happening in August. What are the themes this year and what are the calls to action?
Civic Health Month remains a way that we celebrate that link between health and civic engagement. Groups like the Lancet report came out talking about what's the future of health? What do we need in that future of health? And Celebrated Voices came out and said, we need our democracy to be in good shape. If we want our health to be in good shape, we need our democracy to be in good shape. And those two things are inextricably connected. And Civic Health Month allows us to have that annual celebration of that discussion and make sure we keep that link deeply front and center in our work across both the health space and adjacent spaces. You can treat August as a time where you're taking that simple action of keeping your community's civic health in really good shape and making sure that patients know that there are upcoming local elections that are going to dictate whether they have local grocery stores, that are going to dictate how clean their water is, and using that reminder every year during the month of August. One thing that we have as part of Vot-ER is the opportunity to get a little bit of a competitive spirit in here. And if you are somebody who works in a space connected to a academic medical school, you probably have what's called a Healthy Democracy Campaign team, where you can be a part of that team registering patients to vote alongside various professions within the health space. So if you are in one of those kind of hospitals with that academic component to it, there's a good chance we have a team running in your school and that you can participate in that work in August. So those are great ways to get involved for all different ranges of where people are in their profession and ranges of what type of work people do.
To piggyback on that, we have, as Aliya is mentioning, we have a nationwide competition where schools compete against each other to see who can register the most people to vote using healthy democracy kits that are made for their schools. And there are some nursing schools that are in there too. And so we'll see. Will nursing students beat medical students or beat PA students at registering more voters? We'll see what happens. But if you're a nursing student and you want to be a team captain for your school, reach out to us and we'll follow up with you.
And it's lovely to see how we've built in a healthy competition between the professions. What are some of the tools that help us collaborate and work better as teams?
Increasingly, we're moving towards institutionalizing voter registration and the process of checking your voter registration status into the clinical care pathway in ways that are non-interruptive, right? So it's a sweet spot of how can you embed this into the overall clinical workflow in such a way that does not complicate any other part of the care process. And so, that's why I think the work of Liz and her incredible team at NursesWhoVote doing democracy at Discharge is an incredibly good idea. And in fact, we've seen hospitals that we work with embed voter registration links and the text message codes that we provide into the discharge paperwork for every patient in a mandatory way, so that every single discharge paperwork that's given has the text code in it, has the link in it, has the QR code, so a patient can follow through and do that if they want. We've also seen some hospitals explore the idea of the post-discharge survey that many hospitals have to send, the HCAP survey, as a vehicle to also talk about voter registration and to provide a link. We're already working with patients in this way. We're communicating with them. Why not send them a link to help them register to vote? And then the last innovation comes from the community health center world. And community health centers are special because they take care of this population, right, of marginalized, vulnerable patients. And they text them pretty regularly, right? Many community health centers have a text messaging protocol or process. Did you know our health center can help you with colon screening? Or come check out our new diabetes screening protocol. And so we've been working with about 2 or 3 dozen community health centers now to embed voter registration reminders into those text messages that go out. And just in the last election cycle, we sent almost 500,000 of these text messages out from community health centers. So these are just a couple of the innovations that we're beginning to see.
The innovation that's been buzzing around my brain lately a lot, in addition to the ways that we operationalize Vot-ER, Nurses Who Vote, voter registration in health settings, the innovation that's been sticking in my head a lot is a question around innovating on ideas. And here's the setup. Last year, we expanded how you could vote, all the different ways that we sort of added to or considered adding to how you could vote. And the reason people said they were doing this was, we're in a health crisis, and so we need to make sure that people can still vote. This year, you're now seeing a national dialogue, including 1,000 different bills running through different levels of government, that touch on the question, was last year the place that we should land up to make sure that there are lots of different ways to vote? Or was last year something we just did because we were in a pandemic? And I think that the script needs to flip a little bit. It's not that there was a health crisis and so we had to change the way that we vote and now we, change back. It's actually that if people had been able to vote in the ways that last fall people voted in record numbers, if people had been able to vote all along in ways that gave them access to be able to vote regularly and often, how different would the pandemic have looked? How different would health equity have played out? How different would Alister's emergency room have looked in the heat of things in April and March, where the population of people coming in to be put on ventilators was drastically different than the population of Boston? We need to flip this script. It is about expanding access to vote to help build stronger health equity processes, to make sure that when we land up in a place like 2020, we've already got all the different elements of civic health in place so that our policies are responsive, so that we've already prevented some of the, going back to this word arbitrary, but the arbitrary things that led to some communities experiencing the pandemic more than others. So what's interesting about Vot-ER and our collaboration with Nurses Who Vote and our broader collaborations is we think about innovation in multiple levels. And one of them is in the realm of what are the ideas that stick with us as the reasons and rationale for why we do something.
So I just want to say 2 things. One of them is that curriculum for nursing schools, medical schools, social work schools at bachelor's, master's, and doctoral levels is available at Nurses Who Vote, NursesWhoVote.org. And the second thing is that this job that I have at CUNY impacts more people's health than I ever did as an ER nurse. So lifting people up through education and the public funding of education and making sure that all of our students and faculty are registered to vote and use their vote is really another dimension to the innovation that we can provide.
Yeah, and you have an amazing curriculum that you have made available to how many
For free.
people?
Like 7,000 people. It's downloadable off the website. So people can just download a curriculum. It's plug and play. It's a 50-minute session, and it goes over how voting rights were formed, local, national politics, and then also the U.S. Census. and so a little bit about our civic engagement and the way that our political system works.
What are the other ways that we can engage people in civic health? Voting is an important part. We have a lot of metrics to look at that. But outside of voting, can you give us a list of things that we can do to improve our civic health?
I think at the end of the day, we can't even begin to talk about some of the downstream ways of engaging civically when we have nearly 1/3 of our voting age eligible patients who are not registered to vote. Yeah. And so we've got to do a better job of just having the most basic of basic conversations with folks and getting them invited into the process of registering to vote. Once folks are registered, we have to have another conversation with regard to healthcare providers to make sure they actually vote, because we know from the data, physicians vote at lower rates than the general population, at 10% lower rate. But we've got to make sure that once folks are registered, we take care of that, that people actually show up and get out there and vote. And that's where we've got to start the conversation.
During this past year, our civic discourse has not been as friendly as it needs to be. What are some of those things that we can do to improve our civic health? How do we do it in a way that feels like I want to be a part of it? How is it an invitation that I want to lean into and I feel like I'm part of making progress and making things better?
So I have to say that I'm speaking to this question from my experience. I have one other organization. It's called Conversations New York, and it's a reproducible model for people who want to engage in serious civic conversation by finding common ground and really understanding each other. And I have been doing this particular thing, Conversations New York, which is a model that can be done anywhere. That's why it's called that. Like it could be Conversations Chicago, Conversations Boston, Conversations anywhere. And we do bring people together in sometimes small groups and sometimes large groups to have discussions. And the way to do it is to find the common ground, which very often we all do want. Things like a healthier nation, safer neighborhoods, a better environment, clean water to drink. The tension becomes, how do we get there? And that's really where a lot of times the disagreements are. The goals are very often the same. So it's finding that common ground and then having the patience, having the courage to really sit and listen to somebody who doesn't agree with you and try to really respect it and welcome that pushback. And we really need to do that now because, as you say, our dialogue or our conversation has not always been civil, and it needs to be for us to come back together as a nation.
Elizabeth Cohn, a seasoned and energetic nurse, is the Associate Provost for Research at Hunter College and the Rudin Professor and Associate Dean for Research at the Hunter School of Nursing, City University of New York. She's also the founder and director of Nurses Who Vote, a nonpartisan organization that educates, informs, and encourages nurses to consider the health of our nation when casting their vote. She developed Democracy at Discharge, a companion program that registers patients to vote as part of the healthcare discharge instructions. Not surprisingly, and well-deservedly, Liz was named a 2016 White House Champion of Change in Precision Medicine for her work at the intersection of precision medicine, public health, and health equity. Alister Martin is a practicing emergency physician and former chief resident at Massachusetts General Hospital, founder of Vot-ER, and currently a White House Fellow serving in the Office of the Vice President and the White House Office of Public Engagement. He works at the intersection of public policy and medicine and leverages his background in politics, policy, and the emergency department as a place to build programs that serve the needs of the most vulnerable patients. As the founder of Vot-ER, Alister has led organizing over 26,000 healthcare providers and 300 hospitals to help non-urgent patients register to vote. Aliya Bhatia is the executive director at Vot-ER and Civic Health Month, where she works to bring voter registration into healthcare settings, including emergency departments, hospitals, and community health centers. Aliya began her career as a Teach for America Corps member in New Orleans and as a strategy consultant at the Boston Consulting Group in Atlanta. She completed her master's in public policy at Harvard Kennedy School and is a graduate of the School of Foreign Service at Georgetown University. Aliya understands the connection between health and democracy through a variety of defining experiences while studying, teaching, and working on housing and health initiatives. On a daily basis, as Alister vividly describes, nurses, doctors, and health teams see the unhappy faces and the stressful circumstances of unmet needs, broken safety nets, and failing health policies. Their patient encounters make clear that civic engagement, voter access, and participation is a critical path to reducing health inequities and improving our health policies. A growing body of research confirms that the root of many diseases start with a lack of equitable, prevention-oriented policies, health-promoting environments, and affordable health care. Historically, marginalized communities, especially low-income citizens, people of color, people with disabilities, and those not yet eligible to vote, have borne the brunt of these downstream diseases. Childhood asthma, which is linked to the pollution and a lack of healthy housing, is a classic reminder of this link between upstream policymaking and downstream health disparities. And civic participation itself is shaped by our health and by our illness and disability. According to the U.S. Census Bureau, nearly 1 in 7 registered voters who did not vote in 2008 cited illness or disability as the main barrier to voting. The Centers for Disease Control and Prevention reports that Americans visit hospital outpatient clinics nearly 110 million times a year, and that doesn't include hospital stays or visits to the school nurse, emergency departments, pharmacies, food banks, drive-through immunization centers, and all other health settings. The sheer number of health-related visits rivals the number of Americans served by the Department of Motor Vehicles, where voter registration is an integrated and commonplace option. Provisions of the 1993 National Voter Registration Act encouraging health settings to offer voter registration materials have inspired many health innovators to develop novel and clever ways to educate their colleagues and patients and the public about community prevention and population health-oriented approaches to improving our nation's health and our healthcare systems. During this and every August, Civic Health Month and its vast network of partners are enthusiastically activating their vision of expanding and normalizing health settings as community touchpoints for voter access and engagement by providing thoughtfully designed tools, a foundation for further innovation, encouragement, and information for the relatively simple steps to help Americans register and get ready to vote. An opportunity for helping millions of Americans develop a healthy voting habit, improve public health and health policies, and strengthen our democracy is well within reach. And it starts with a lanyard and a quick question. Ready to vote? For See You Now, I'm Shauna Butler. Thanks for listening and for voting. And happy Civic Health Month.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.